High blood pressure, hypertension, is a common condition where the long-term force of blood against your artery walls is high enough to eventually cause health problems like heart disease. Blood pressure is determined by both the amount of blood your heart is pumping and the resistance to blood flow in your arteries. The more blood your heart pumps and the narrower your arteries, the higher your blood pressure. A blood pressure reading is given in millimeters of mercury (mmHg). It has two numbers. Top number, systolic pressure. The first or top number measures the pressure in your arteries when your heart is beating. Bottom number, diastolic pressure. The second or lower number measures the pressure in your arteries between beats. You can suffer from high blood pressure for years without symptoms. Uncontrolled high blood pressure increases your risk of serious health problems, including heart attack and stroke. Fortunately, high blood pressure can be easily identified. And once you know you have high blood pressure, you can work with your doctor to get it under control. Most people with high blood pressure have no signs or symptoms, even when blood pressure levels reach dangerously high levels. Some people with high blood pressure may have headaches, shortness of breath, or nosebleeds, but these signs and symptoms are nonspecific and do not usually appear until the high blood pressure has progressed to a severe or life-threatening stage. Causes. There are two types of high blood pressure. Primary, essential, hypertension. In most adults, there is no identifiable cause of high blood pressure. This type of high blood pressure, called primary essential hypertension, usually develops gradually over many years. Secondary hypertension. Some people have high blood pressure caused by an underlying condition. This type of high blood pressure, called secondary hypertension, tends to come on suddenly and causes blood pressure to be higher than primary hypertension. Various conditions and medications can lead to secondary hypertension, including obstructive sleep apnea, kidney disease, adrenal tumors, thyroid problems, certain congenital defects in blood vessels, certain medications, such as birth control pills, cold medicines, decongestants, over-the-counter pain relievers, and some prescription medicines, illicit drugs such as cocaine and amphetamines. High blood pressure has many risk factors, including age. The risk of high blood pressure increases with age. Up to about the age of 64, high blood pressure occurs more frequently in men. Women are more likely to develop high blood pressure after the age of 65. Race. Hypertension is particularly common in people of African descent and often develops at an earlier age than in whites. Serious complications such as stroke, heart attack, and kidney failure are also more common in people of African descent. Family history. High blood pressure runs in families and can be passed on from one generation to the other. Overweight or obese. The more you weigh, the more blood you need to carry oxygen and nutrients to your tissues. As the amount of blood flowing through your blood vessels increases, so does the pressure on your artery walls. Not being physically active. People who are inactive tend to have higher heart rates. The higher your heart rates, the harder your heart must work with each contraction and the stronger the force on your arteries. Lack of physical activity also increases the risk of being overweight. Use of tobacco. Not only does smoking or chewing tobacco temporarily increase your blood pressure, but the chemicals in tobacco can also damage the lining of your artery walls. This can cause your arteries to narrow and increase your risk of heart disease. Secondhand smoke can also. Too little potassium in your diet. Potassium helps balance the amount of sodium in your cells. A proper balance of potassium is critical for good heart health. If you don't get enough potassium in your diet, or you lose too much potassium due to dehydration or other health conditions, sodium can build up in your blood. Too much salt, sodium, in your diet. Too much sodium in your diet can cause your body to retain fluid, which increases blood pressure. Drinking too much alcohol. Over time, heavy drinking can damage your heart. More than one drink a day for women and more than 2 drinks a day for men can affect your blood pressure. Stress. Severe stress can cause a temporary increase in blood pressure. Stress-related habits such as eating more, smoking, or drinking alcohol can further increase blood pressure. Certain chronic conditions. Certain chronic conditions also may increase your risk of high blood pressure, including kidney disease, diabetes, and sleep apnea. Sometimes pregnancy also contributes to high blood pressure. Although high blood pressure is most common in adults, children can also be at risk. In some children, high blood pressure is caused by kidney or heart problems. But for an increasing number of children, poor lifestyle habits, such as unhealthy diets and lack of exercise, contribute to high blood pressure. Complication caused by high blood pressure. Heart attack or stroke. High blood pressure can cause the arteries to harden and thicken, atherosclerosis, which can lead to a heart attack, stroke, or other complications. Aneurysm. Elevated blood pressure can cause your blood vessels to weaken and bulge, creating an aneurysm. If an aneurysm ruptures, it can be life-threatening. Heart defect. In order to pump blood against the higher pressure in your vessels, the heart has to work harder. This causes the walls of the heart's pumping chamber to get thickened, left ventricular hypertrophy. Eventually, the thickened muscle can have a hard time pumping enough blood to meet your body's needs, which can lead to heart failure. Weakened and narrowed blood vessels in your kidney. This can disrupt the functioning of the organ. Thickened, narrowed, or ruptured blood vessels in the eyes. This can lead to vision loss. Metabolic syndrome. This syndrome is a group of disorders of your body's metabolism, including enlarged waistline, high triglycerides, low high-density lipoprotein HDL cholesterol, the good cholesterol, high blood pressure, and high insulin levels. These conditions increase the likelihood of developing diabetes, heart disease, and stroke and dementia. After all being said about high blood pressure, its causes and some risk factors associated with it, there are some natural foods that can help maintain it and keep it balanced. These are. If you love this video, kindly subscribe to our channel and hit on the notification button as Basil Ocimum basilicum is an aromatic herb that comes in a variety of forms. This herb is popular in herbal medicine because it is rich in various powerful compounds. It is rich in eugenol. Research has found that the plant is an antioxidant and has many health benefits, including lowering blood pressure. Parsley is a popular herb in Middle Eastern, European, and United States cuisines. Native to the Mediterranean region, it has an impressive nutritional profile. Parsley contains a variety of compounds, such as vitamin C and dietary carotenoids, that may lower blood pressure. Several studies have shown that carotenoid antioxidants lower blood pressure and LDL bad cholesterol, a risk factor for heart disease. 3. Celery seed. Celery seed is a versatile spice that's full of various nutrients like iron, magnesium, manganese, calcium, and fiber. Interestingly, some research suggests that celery seeds may help lower blood pressure. Garlic. Garlic is rich in many compounds that can benefit your heart. Garlic, in particular, contains sulfur compounds like allicin. This helps increases blood flow and relax blood vessels. Together, these factors can help lower blood pressure. Cinnamon. Cinnamon is an aromatic spice that comes from the inner bark of trees in the genus Cinnamomum. It has been used by traditional medicine for centuries to treat heart conditions, including high blood pressure. Thyme is an aromatic herb that is packed with numerous healthy compounds. It is a common herb in your kitchen, used to flavor your meals. Rosmaric acid is one such compound. Research has linked them to many benefits such as reducing inflammation and blood sugar levels and increasing blood flow. It can also help lower blood pressure. Eat berries. Berries are packed with more than just juicy flavor. They're also packed with polyphenols, natural plant compounds that are good for your heart. Polyphenols may reduce the risk of stroke, heart disease, and diabetes, as well as improve blood pressure, insulin resistance, and systemic inflammation. For improved health conditions concerning HBP, try adding the foods mentioned to your meals.